Welcome back to TNT. It's Monday, and we've got a guest with us. Hi, Rob. How are you?
Good. How you doing?
Judy Brunton is our guest. Judy, welcome to TNT. We are talking with you today because of your efforts with the Canadian mental health and all of the fundraising that you've been doing. And so I know for sure that during this period of time, it's been difficult for everyone who's fundraising. So we'll get into that a little bit later. But Rob, let's start us off. Judy, well, you'll learn by the last time. Last time, you're going to do it when we leave. Ready? 1, 2, 3. TNT. Okay, Rob.
Thinking, what am I on here for?
There you go.
Well, mental health. That's why we're here. Okay. So I do have a couple of questions, though, Judy. So first of all, how did you start into this business? Like, what got you in this?
Okay, so I used to fundraise.
Fundraiser, yeah.
Yeah, I used to fundraise for another organization many years ago, and it involved a walkathon. My older son, he loved to bike ride. He didn't want to walk, he wanted to ride. So I went online searching for a bike ride fundraiser that had a low registration fee, because you can pay $80 to do a bike ride, and I'm like, I'm not going to pay that. So I found, by accident, Canadian Mental Health Association, York and South Simcoe, and their fee at that time was $45, and Carl's was free because he was a child. So immediately I left the other organization. I started with CMHA. My sister was diagnosed with her first mental illness when she was about 15 or 16. And so right when I saw mental health, I had to do it. And so my son and I did our first ride when he was 7. He did 20 kilometers.
Wow.
And he's stronger than I am. He's like, the kid's like, yeah, he's fit. I'm not. So we did 20 kilometers, the first ride. Pardon, Rob?
I'm driveway and back, and that's about as far as I go on a bike.
This is the only bike ride I do every year. So I started doing that. And the first year I didn't raise a lot of money because I still was fundraising for the other organization, so I couldn't ask for people for money just yet. So the year or two after that is when I started collecting more and more money. So far, over the 6-7 years I've been fundraising for them, I've raised $85,000, $90,000, almost $95,000.
That's amazing.
So, yeah. Right now I'm trying to get up to $15,000 for this year in order to get $100,000 for the whole time so far.
Nice. Okay.
And how far along are you in that $15,000 goal?
I'm about 5,200, 5,300 away.
Okay, so you're close.
So it's close, but it'll be a long road still. Now, the money that we raise every year goes towards that ride, which takes place normally June 14th. Well, this year it was going to be taking place June 14th, as everything else has been canceled. So we're still fundraising. That ride was called Mental Health in Motion. We're still fundraising, and now we're just calling it Mobese in Motion. So, because we still want to keep the bus going. Now, for anybody who doesn't know what Mobese is, it's, first of all, it's spelled MOBYSS, which is a mobility youth South Simcoe. I can't remember what it stands for. It doesn't matter. It helps, and that's the main thing. The big youth RV that previous to COVID would go around to locations where youth are, so homeless shelters, community centers, libraries, high schools, and youth 12 to 24 can go on that bus and talk to a nurse practitioner, and there's other support staff. I can't remember their titles, but to have not one, but 2 nurse practitioners is amazing, because they can do anything a doctor can do except for prescribed medication. So youth can go on that bus. They do not have to use no hip. They do not have to use their name. They can tell them they're Jane Doe. They can go on as many times as they want, continually. Every time they can follow the bus around and go wherever their bus is. Mm-hmm. They can talk to them about sexual, physical, or mental health. And it's not a psychologist, but they're going to get a lot of help right away. And there's been a number of youth, I don't know the number, who've gone on that bus in acute suicide state. And because of the bus, they're still here with us. Because acute suicide state means they have a plan that day to die. So the bus is able to save us from losing them.
Yes.
So currently the bus isn't running, so the Mobese team is working with the youth, either telephone or video conferencing, such stuff, like ways like that. I don't know.
Are they, Judy, are they connected with Kids Help Phone at all, or is that something totally separate?
Nope, it's all Canadian Mental Health Association that the Mobese team is with,
Okay.
and it's all like I don't know if we get government funding. I don't want to say yes or no because I can't remember, but they do rely on a lot of fundraising.
Mm-hmm.
And the bus. Oh, sorry. Go ahead, Rob.
I was gonna say, is there a contact number so if somebody was to reach out that bus would just come out, or like how do you get them out to these events? The bus.
So it's not events. What it does is it's on when it is running. It's on a 2-week cycle. So if it's at say the Bradford Library 2 o'clock on a Tuesday, 2 weeks later it'll be at the Bradford Library 2 o'clock on a Tuesday.
So it's always there, consistent time when it is.
Yeah, and it runs Monday to Friday. I can't believe the times it runs. And when it is up and running on the Mobese website, it actually has like a schedule. So if you click on this day, it'll tell you where it'll be. Click on this day, it'll tell you where it'll be. Now, it doesn't work Saturday and Sunday because they have to have the staff, and staff want days off, so they don't work on Saturday and Sundays. But there's phone numbers they can call in on the weekends and still talk to the people when they need to.
That's good.
Because like right now, like people think that it's not a pandemic issue, but youth who are suffering before this with depression, anxiety, schizophrenia, etc., are suffering even worse now. They're angry because they don't know why they're not being able to go to school. They're upset because they can't see their friends. They're worried about their health, their family's health, their friends' health. They don't know when they're going to see their friends again. So it's like so confusing for them. They're isolated with their family. And some youth, they can't talk to their families about this because they don't understand or they don't believe that you have an illness. So they have nobody to go to but the Mobese team. So
I was going to say, if anything, it's not more of an issue now today with like I can understand that. Like all of a sudden, here's your prom coming up in June and it just got canceled.
Yep.
Here's your school year. You're going to graduate. You're not even going to a graduation probably this year. So things that traditionally are always there and the things you kind of work towards are now gone. And that could create a lot of mental issue. You know, I could totally get it. So are you seeing more activity now because of that? Because of those issues?
The Mobese team is, I don't deal with them. I don't know the exact numbers. But they are seeing more and more anxiety. But the youth are getting the help they need, and they're being able to talk them through what they're not able to do. Like they can't even see their friends. They don't know when they can see their friends next. Like they're not allowed to see their friends except for on video conferencing. And for some youth, it's not comfortable for them to talk face to face on screen time like that. They much rather just hang out with their friends and know they're there for them.
Right.
So
they don't communicate a lot. Just being present. They're
exactly
on phones, but they all have each other around them, even though they're not.
Exactly, and they're not allowed to do that now. So for who knows how long.
Yeah.
So
because of COVID, has the bus stopped? Is that why?
Yeah, because you can't keep them, like you can't do the 6 feet apart.
Right.
That's
right.
a tragedy. So
the bus can't run.
So do you know what its plans are, or what are you attempting to do, or is it just the general fundraising you're attempting to do right now? And do we have a plan on when that bus will open?
The bus will open when the government tells us we can go back to some sort of normalcy and be a little bit closer, because like when a youth is being examined, not necessarily for mental health, but for physical health, they need to be touched by the nurse practitioner. Well, you can't touch them 6 feet apart. So if they're being examined. So yeah, we don't know when it'll go back. The government tells us that. So, but sooner the better for the youth, obviously.
So what you're doing now, what are those fundraising efforts going towards?
It still pays for the staff to be working to help the youth. And then when if that funds aren't needed for that, then they'll just put it towards when the bus is running, and they'll use it for that, because it costs about $1,300 a day to keep the bus running when it is in motion. So because like the staff are paid, they have to be paid, right? And then there's like the fuel, the maintenance of the bus. So, and RVs aren't meant to go stop. RVs are meant to go and stop for a long time, right? They're not meant to be constantly on the road.
That's right.
So what are you doing to fundraise now? Like if you're going to the public, how can you raise money, or how can they contribute to
Right
this
now, I simply beg as many people as I can. I post on Facebook as often as I can, but I don't want to do it too often because people don't like that. And then I email all my contacts and just ask for financial donations from people who are able to do it.
Mm-hmm.
And as of now, that's all I can do. I had a fundraiser that usually runs Mental Health Awareness Week, which was last week. And I wasn't able to do it because it involves asking businesses to donate part of their profits. I can't ask them to do that. They're not in business. It's not right.
Right.
So now it's just doing as much as I can by getting money from whoever can give any amount. And then my friend Tracy Sheldrake, she's doing a fundraiser raffle where there's a number of local women who are in business. I don't know the correct term.
Yeah.
And altogether, they're donating up to $400 worth of prizes, and the raffle tickets are $5 each. And that, I don't know how long that's going to go on for. Tracy hasn't told me, so we're just slowly starting to sell the tickets. I'm posting that all over the place, and then when I get the prizes, notification of all the prizes, I'll add those onto the post so people know what they can win.
That's excellent.
So,
I know you're not alone, Judy, and it's no comfort probably, but we talk to a lot of fundraisers, and they're a sector that has been hit really hard. I mean, they depend on the donations, and the people who you help depend on the donations. And when that falls off, and it's unfortunate. So every little bit, I would anticipate at this point, helps. I know the government was supposed to contribute in some way, but I'm sure that that's a sticky situation.
yep.
But
Let me ask you, other than money, is there anything else somebody could donate, or is it really just the cash that you're kind of?
At this point, it's just the cash because, like, the awareness is awesome. Don't get me wrong, but the money is what actually helps pay for the programs that the youth are so desperately needing right now.
Right.
So, like, when I do my fundraiser in November, which I still don't know if I'm going to do it, it's a big fundraiser I do the first Saturday every November at the community center Newmarket. I ask for donations from companies for auction items, but I can't ask people because it's not right. Because you don't know who's in business and who's not. And I'm not comfortable asking for that right now. So right now, sadly, monetary is the way to go. And if people can't, like, I email a couple of my friends, and I started out by using some phrases that CMHA gave us, basically saying, like, I feel really uncomfortable asking at this time, but if you are able to donate a few dollars, it'd be awesome. If not, please don't worry whatsoever. And then some people say, yes, I'll definitely do it. Thanks for the reminder. Other people say, sorry, I can't because I'm not working right now. And I like, totally understand that. And I don't want them to feel bad because I don't want to take money from people who don't have money. So.
Yeah.
So what's the one thing you want people to know today? What's the message we can get out to everyone today?
Basically, I always keep going back to money. I don't know why.
That's okay.
If you can donate $1, if you can donate $5, we are greatly appreciative of it because there's so many youth who are in need, and we need to help them today so we don't lose them tomorrow because they don't know what to do, and we need to get them the help.
Yeah, I think it's a wonderful, wonderful thing you're doing. I mean, you know, people need to be out there for people who don't have a voice.
Exactly.
And yeah, I thank you so much for doing what you're doing.
You're
Definitely.
welcome.
Okay, Rob, you got any questions for Judy?
No, I think it's great. Like, what you're doing is fantastic. I definitely see even more of a demand for what you're doing right now than what we've ever had before. Like, it's, you know, the youth are going through something that nobody's ever experienced before, and you're in a different mindset at that age, by all means, right? So you don't maybe know how to cope with it, and that's why I think it's really important that it gets out.
Mm-hmm.
But yeah, anybody that can obviously give $1, give $5, give whatever, it helps, right? Return the beer bottles if you have to, and chip it in if it comes down to that. It gets.
Or
there you go.
Don't drink the beer and give me the money instead.
Yeah.
But we'll take the empties. That would be a good one.
Don't buy it. Just give me that money because that's more than the empties.
I thought you were going to ask for a case of beer, but that's okay.
Exactly. Like the youth before this, they don't know what to do with themselves, and they don't know where to go to. Now it's even worse. So it's so hard for them. Like, what? Imagine one of their loved ones, whether it's a parent, a grandparent, aunt, uncle, gets COVID and goes in the hospital. That's even more traumatizing for them because now they can't help them and they don't, like, they're worried, and that's even worse. So if you have a mental illness, if you have depression, it doesn't just go away if you don't get help. It gets progressively worse. And we don't want to get worse where we lose that youth. So
we're going to put your links on with this video, and we encourage everyone to go to those links, check them out, see what Judy's doing, and if there's any way at all possible that you can help, then by all means. It certainly sounds like Judy's not looking for a windfall. Just a little participation from everybody, I think, would add up if they're able. And
exactly.
Yeah, and we're certainly conscious of that. I got to thank you so much for coming on. I'm really glad we had you on. This has to be a huge awareness to people. If they've had experience with it, it's at the forefront of their mind. But if they haven't, it's a difficult concept for people to understand. And
it's sad because, like, other illnesses, everybody understands them, but people don't understand this. It's 1 in 4. Like, 1 in 4 people can have mental illness. Everybody knows somebody who has mental illness. They just don't necessarily know that that person does, because not everybody wants to tell people because they're ashamed.
Yeah.
So, but everybody knows somebody.
Yeah. Awesome. Okay, so everyone check out those links. That's all I can say. And if you can now or later, help out. But tag that post on Facebook so it always comes up. You get to see Judy's posts in the beginning so you can see what's going on. Thank you for coming on, Judy.
Thank you very much. I appreciate it. Okay,
you're welcome. Now you got to put your fingertips together with us. And we are going to TNT out of here. Rob, 1, 2, 3. All right.
Love it.
Thanks, Judy. Have a great day, everybody.
Thanks, guys.